I know this thing is on, and I know that you can hear me. Nursing and healthcare needs advocates and activism. So what are you waiting for? Let's do the damn thing. Hi, and welcome back to The Gritty Nurse, an unfiltered conversation about healthcare, nursing, and the intersection of health politics and policy. My name is Amy, and I am The Gritty Nurse. This podcast examines hot topics in healthcare and discusses the changes that we need to see to have a more efficient, robust, and ethical healthcare system that is safe not only for the patients that we see, but also for those who work in the system as well. Sorry, no fluff here, just awesome, compassionate humans and a lot of grit. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit that subscribe button so you never miss out on any real stuff from The Gritty Nurse. So today we are talking about the reality within nursing and the concerns about nursing being at a breaking point. But how about if I said to you that we aren't just talking about cracks in the system, we're talking about how we can build a momentum and movement to rebuild it from the ground up. Today, I'm honored to be joined with the leadership of Nurses Shift Change, a nurse-led grassroots movement born from the urgency of our current political, social, and healthcare crisis. First, we have Dr. Danielle McCamey. Danielle is an acute care nurse practitioner with over 16 years of critical care experience. She is the fellow of the American College of Chest Physicians and a powerhouse founder of the CEO and president of DNPs of Color. Her career is a masterclass in advancing diversity, equity, inclusion through mentorship and community empowerment. Also, we have Gloria Barrera. Gloria is a public health and school nurse leader and an ANA Illinois Nurse Influencer of the Year and a 40 Under 40 honoree in public health. She is the co-founder of Nurse Heroes for Zero and the Society of Latinx Nurses, an alumna of Healing Politics 2025, and a dedicated advocate for health equity and climate justice. Gloria and Danielle, welcome to the show. Before we get started, maybe we'll start with you, Danielle. Could you tell us a little bit about yourself, your background, and maybe both at some point can tell me a little bit what led to Nurses on Shift Change. So start with you, Danielle, and then to you, Gloria.
Okay, awesome. Well, thanks for the opportunity to be here. So incredibly excited to be on your show. But I am Danielle McCamey. The resume, I'm an acute care nurse practitioner turned academician, and I'm also the founder, CEO, president of DNPs of Color. But my main jam is, I always say my tagline is I build communities that create opportunities. And throughout my life and career, I have always had this knack of identifying gaps and coming up with innovative solutions, but centered around building community. From a very young kid, I've always recognized the power of bringing people together and using that collective wisdom, collective energy, collective strength to advance whatever that center focus and mission of that particular group was. So that's what led me to building and founding DNPs of Color and also being a co-founder of Nurses Shift Change. But I'll pass the mic to Gloria to share about herself as well.
Thank you. First, thank you for having us on this platform and for giving us the opportunity to really amplify what we're doing with Nurses Shift Change. My name is Gloria Barrera. I am a public health nurse, but I also am director now of an RN to BSN program at a university here in Chicago. So my background is with that public health focus. And I think the reason that I was called to Nurses Shift Change to join the movement, to be fortunate and had the pleasure of being one of the co-leads through the Society of Latinx Nurses was because there is this huge need right now that we're seeing of nurses needing to come together collectively and to talk about the systems, the policies, and the issues that are impacting us and creating the space and the tools that they need to really show up for themselves, for the communities that they serve, and for the interest of all of public health. So that's why I gravitated towards Nurses Shift Change, and that's why we're here today.
Yeah, no, thank you both for sharing your backgrounds and some of the work that you do. Again, I think it's good that we have various different backgrounds that we're coming together with that same mission and goal in mind, really talking about how do we shift change in relation to nursing. And I think it's so important that we have these grassroots groups, because I think, we have associations, we have organizations, but it doesn't have the same feel as people who truly understand what nurses are saying, what are some of the concerns. And you don't have to be there's a word for it, but there isn't those specific politics that associations have, where you can really truly say what is kind of on the mind and the forefront of nurses, on the ground. One of the things that I feel that, both talk about so much is reclaiming the soul of nursing through the HESS principles. And I think it's important that we discuss what they are, because I would say that it is fundamental that we talk about these principles. But do you feel that we as nurses, or nursing as a profession, has maybe lost their way a little bit? Again, in a system that prioritizes billable minutes over human connection, how can nurses practically continue to use these principles to fight back and to shift change? So maybe we'll start with Gloria first.
Yeah, when I think about HESS, I do have that public health background in school nursing. So public health is complex. We know that. And I think before we talk about HESS, I want to talk about why that framework, why that matters at all, especially in public health. The complexity increases. We know that we need that shared language in public health, and we need ways to name and what we're seeing, to name it and to explain why it matters, and decide then how to act without oversimplifying the reality that we're seeing every day. So
Right.
frameworks don't replace the evidence that nurses are seeing. They organize it. So then they help us move from data to real meaning, observation to then strategy, and then concern to action. So HESS is one of those frameworks, and it exists because traditional public health approaches, while they are essential, they often fail to fully capture that lived experience, the ethical tension, and the power dynamics. I think for your listeners, HESS, you can see it on our website. It stands for humanity, ethics, social justice, and science. So HESS is that value-based public health framework designed to guide the decision-making, advocacy, policy, and the system changes, especially in moments of right now uncertainty, crises, and inequity. So it does not replace epidemiology, biostatistics, or evidence-based practice, but it does ask us to just look at it from a different viewpoint and ask a different question, perhaps. Are we using our evidence in ways that honor people, protect dignity, and reduce harm, especially for those that are most impacted? So HESS centers how decisions are made, not just what decisions are made.
I think that's powerful. To you, Danielle.
I want to pause for the previous segment. That I think the word that you were looking for is gritty. Grassroots is gritty. And I view nurses shift change as that cousin or that play cousin that you call, like, look, we ride at dawn.
Right.
And I think that we wanted to channel that energy because of associations have their place, but they also have a lot of layers and levels that almost hinder them to be able to progress or really move in the moment. And I think that the value that Nurses Shift Change movement brings is meeting that moment with movement that's not bound by established rules. We have to get the board approval.
Right.
And I think that a lot of us value having that nimbleness and that ability to be able to move when it's time to move. So Nurses Shift Change Grassroots is gritty, which is why we on the Gritty Nurse podcast.
Right.
So moving to this segment of HESS, Humanity, Ethics, Social Justice, and Science. One thing about public health nurses, they're going to bring it back to everything public health. And I just recently have acquired a love and appreciation for public health nursing and public health in general. I'm an acute care nurse practitioner. If it ain't intubated, sedated, multiple drips, multiple machines, I ain't worried about what the public health issues were that brought them to my ICU though. I'm either trying to rip them from the throes of death or usher them to having a dignified death or a new baseline of life, quality of life. But I never asked the question, why are my patients continuously coming to my doorstep in the ICUs, and not really tracing back to the public health, the social drivers of health that are connected to the policies that shape people's ability to have access to quality education, housing, food, transportation, the basic necessities of having a community that supports their well-being and humanity. But now that that light bulb has turned on, I can't unsee it. I'm like, my practice in the ICU is directly tied to the public health issues that are directly tied to the policy and laws that are dictating who has not.
Right.
And so I've developed this, I don't want to say just this passion for having that more upstream, fully encompassing perspective that I've added to my practice, that I'm also sharing with my students and letting them know, like, yes, your responsibility is this as a nurse, but if you don't know how to advocate for yourself, you can't advocate for others. And this is how you learn how to advocate for yourself, and discovering what issues, I always like to say, burn your biscuits. And you find other people that have the same issues of their biscuits being burned by a particular issue. And it doesn't have to be you out here in the streets with a bullhorn.
Right.
It could be something as simple as like, well, why do we have this policy in our ICU unit that says ABC and 1, 2, 3? Like, where did we get this from? Oh, the articles that inform this policy are from 1981. So much has changed from then,
Yeah.
so it's just, I'm on this quest of trying to spark any sort of flame in people to see the connection of all of this as we have the opportunity to care for people in our superpower of nurses, but taking it a step further, having that understanding. And so when we were thinking about curating this group, the framework HESS and the group, we were just like, what can we get behind as a profession that's not linked to anyone's particular mission, vision, goals, or agendas? What
Right.
is the foundational energy, soul of nursing? And we all agreed humanity. Like, we can't ignore people's humanity and how they show up, because as nurses, we get that opportunity to see that in the most rawest, realest, vulnerable states. And then we were like, okay, we can all agree humanity is a thing. And then it was the 75th anniversary of the ANA Code of Ethics last year. So we were like, well, we all have agreed that the Code of Ethics is a foundational guide to how we govern ourselves in practice. We were like, ethics has to be a thing. And then social justice has always been the foundational thread of nursing. So it was like, we have to have social justice. And then science.
Right.
We're seeing that science is evolving into something that is not science. And contrary to people's understanding and belief, nursing is a science, but is also an art. So we wanted to have that foundation that we felt like was fully encompassing of the foundational things within the profession that signify a thread of connection despite specialty, hierarchy, whatever. And so HESS has been the guidepost for us to find that connection, because we don't want to compete with other groups. We value the associations and other groups that are putting forth the effort to value humanity, ethics, social justice, and science. But we view ourselves as the opportunity to unify nursing. In my mind, I'm like, can we just all unify for one day at the Report for Duty rally on May 7th? One day, just a million nurses come to DC, like, we out here. We're the most trusted profession. We are over 4 million strong. We understand the immediate needs and have the solutions to some of these issues. So all that to say, HESS is the framework. That's the mind behind it. Public health is sexy. I'm an honorary public health nurse. I can't unsee it. And I definitely want to bring that to people's perspective, that understanding the through line of all of this is around public health, community policy, and laws.
Yeah, no, I think you're right, Danielle. And I'll circle back to you, Gloria, as well about the underpinnings of, public health, as well as the fact that, one of the things that I remember was one of my first lessons in nursing was even just talking about the social determinants of health and just remembering how important all of those things that you mentioned, like food, housing, income, how all of those things intersect with the way that someone's health is delivered, how their health might be affected. And we see it time and time again in various different ways, whether we talk about intersections of race or mental health or disability, and just understanding that it's fundamentally, if people don't have housing, that's a problem. I actually talked about I think it was a couple weeks back where I did a TikTok of a doctor here in Toronto who prescribes housing. He's the first physician who's ever prescribed housing as something that, is fundamentally needed, which makes sense because it's how do you heal or dress a wound if you don't have a house or a place to make sure that it doesn't get infected, right? So again, just thinking about and having nurses think about where all of these things come from before they enter their doors. And again, back to you, Gloria, when you mentioned the whole principles behind, these don't replace those various different structures, but these underpinning things, like you said, humanity, ethics, the way that we involve sciences, and the way that we also, we talk about social justice, all of those things should impart on the way how we deliver our nursing care and nursing services to the various populations we serve. think I think it's such a beautiful framework. And I think that's something that, should be underpinning all of our values. And again, I'll circle back because we're going to have to talk a little bit about social justice and ethics a little bit later. But I think it's important. The other piece that you said that, can we just have a moment where we bring all nurses together? Because I fundamentally feel, and maybe I'm wrong, but I hope I'm not, that for the most part, we're all on the same page. We all want to see better healthcare outcomes for the patients that we serve, right? And I think it's important that we have that moment where we can come together, because I would say that probably one of the weaknesses that we do have is we do not organize very well or effectively. And I think that if we could figure it out, that nursing as a whole would be such a powerful group. And I think that, starting with these things, like you mentioned, mobilizing the Million Nurse March in 2026 are pivotal moments and are groundbreaking moments that nurses can come together and say, you know what, we do have a lot in common, and we do want to show the public that we do stand united in certain issues. So one of the things that, bringing it back to this. So many nurses feel that their voices are silenced by hospital administrations. So how does Nurses Shift Change plan to turn individual frustration into that kind of collective power? So tell me a little bit more about the 2026 Million Nurses March, and we'll start with you, Danielle.
I think when I think about Nurses Shift Change, and I shared this at our year-end review, that being part of this group helped me find my voice in advocacy and what that looked like, and helped me channel some of my frustration or anxiety with using my voice in any way, but in an advocacy way, and seeing how empowering it was for me, but just having a community to help me think through what my voice is and where I want my voice to fit in, because there's room for my voice. And I've always felt like, having to kind of duck and dive and strategize in terms of how to insert myself and elevate my voice in the things that are important to me. And for those that feel like you don't have a voice in your hospitals or your respective practice areas or working environments, is first have that recognition and awareness of that, and strategize to find a community where you can find that voice, and get the support to be able to use your voice. And I know that's easier said than done, but the key is finding the community. And when you find the community, you're going to be welcomed, because everyone's like, that burns your biscuits? It burns my biscuits too. Let's go in and see how we can butter these burnt biscuits instead. So, coming back to that community piece and taking that step out on faith to seek those folks who also has the same burnt biscuit issue.
Yeah.
Has been incredibly powerful for me. With the Report for Duty rally, we felt it was important. So I'm into branding. And so for me, it was like we were brainstorming the name of everything. We put so much intentionality in being deliberate with how even the name of the group and some of the initiatives that we put together. We felt like nursing language was everyone could identify it. And so the nurses shift change movement came from nurses understand shift change. Nurses outnumber all healthcare professions. Because of that sheer volume and us being the most trusted profession, that is cash currency that we need to start cashing in on. And so it was like, so we should be leading the change. So that's how nurses shift change. Then was this energy of, we need to be out here in these streets. So it was like, all right, well, we ain't trying to march because that's a whole lot, but let's rally. And so thinking about what the branding around our first major action, call to action, report for duty rally. It's like everyone knows what report for duty is. And so wanting to bring in the intention of having that energy around the rallies. Last year we launched within a month. It was like, you know what, we're doing this. We're picking a date. Yeah, we understand it's Memorial Weekend, but we just got to get started. Shout out to Marion Leary and Rebecca Love, because when I first brought together a group of nurses, I'm like, we need to be out here in these streets. And everyone's like, okay, great. Yes. How are we going to do it? And I'm like, I was hoping y'all knew how to do it. Nobody knew how to mobilize.
Right.
And it was like, man, like we're of this generation that came from generations that knew how to mobilize, strategize to mobilize movements. And I'm like, we're in a social media era where you put a hashtag on and it's like, all right, we there. But so we had to kind of learn together in that moment. And so with strategizing, bringing everybody together, created this spark, and we knew we were growing together. So with that, we did satellite sites where people that couldn't make it to the main rally in DC. So we had site leaders, across the nation. I think with our first kind of launch of Report for Duty rally, we had about close to 500 nurses in total across the nation participate, be present for. And then the main rally in DC where Dr. Monica McLemore was our keynote, and we had a whole host of speakers. So this year it's going to be the same format. We're going to do a Report for Duty rally on May 7th, which is during Nurses Week,
right,
specifically Mary Eliza Mahoney's birthday. And it's going to be same format, having site leaders across the nation. We're going to have a hybrid experience, and we were hoping that maybe you could be our host of our virtual community, just so we can make it accessible for people. And then after the rally, we're going to host a Capitol Hill Day. So it's like, you saw us on the lawn, so now we're going to be in y'all's office.
right.
So it's going to be a full day of advocacy. And we recognize we may or may not get 1 million, but we're going to keep doing it year after year until people get that we just want for one day.
Right.
That's it. Put all agendas and pettiness and silos aside. And I know nursing is capable because we saw this spark when the declassifying of nursing as a profession.
Right.
I said, okay, so nursing is not all the way dead. That was like a defibrillation. Like, oh, hold up. And I'm like, can we keep this same energy around humanity, ethics, social justice, and science? Can we keep that same spark energy of rallying together for one day?
Yeah.
May 7th in DC and across the nation.
Gloria, what do you have to add?
Yeah, I think I love that you said the defibrillation. I think that that's what we all needed.
Yes.
Because nurses shift change, we know that it really did emerge from that lived nursing reality that we all know and we speak about. And it's the burning biscuits that Dr. McCamey just shared. But it comes from the decades of nurses and in nursing being just asked to absorb all of the harm quietly while systems remain unchanged. So I do want to be clear about something at the start of the conversation. This is not just a feel-good discussion about nurse empowerment. It's not a motivational talk or a motivational march about resilience. This is a very strategic, ethical, and a professional reckoning with where nursing sits in this moment in history. So because nursing is no longer at the margins of crises, we are at the center of converging failures. We all see it in our practice, no matter where you practice, the healthcare delivery, public health infrastructure, climate instability, right? Workforce collapse and erosion of trust. So nurses are being asked implicitly, I think, and also explicitly to hold it all together and to do it anyways. But when we talk about nurses shift change, we are talking about a really necessary evolution of nursing leadership. So it's not an optional one. And I think that the foundational problem of nurses shift change addresses that we are trusted with lives. We are trusted with judgment, our own judgment, nursing judgment, our professional judgment, and we are trusted with handling those crises. But we are systemically, I think, and systematically excluded from policy design, budget allocation, infrastructure planning, environmental decision making, and that workforce strategy. So this is not accidental, but now I think that the veil has been lifted. We know that now. We're going to do better now. Nursing has been historically positioned as a responsive profession, not a directive one. But we are trained now to stabilize, to mobilize, to adapt, and to mitigate the damage that has been done. But now we are questioning the upstream conditions that are producing the harm that we're seeing. So I think that that's the hard truth that we have to really look at and know that as long as nurses continue to be compensated and to do that in a silent way, systems have no incentive to change. So with nurses shift change, I hope that people will hear our call to march and to be part of this movement. It's not a single campaign. It's not a this year and that's it. We're going to dissolve. It is not just one issue platform. It's not a short-term movement either. So it is a long-range strategy for that collective nursing influence that's rooted in those non-negotiable pillars, HESS. And I can't wait to see what the next, year, 2 years, 5 years, decade looks like when, like Dr. McCamey said, that we're all now focused and we've been defibrillated. We're alive now. And what are we going to do with this moment?
Right.
So I think that that's powerful. And I welcome everybody that's listening to be part of this. And there's that quote, right? Like when you want to go somewhere fast, go alone. But if you want to get there, I think it's like the sustainability factor. You have to go together. So please join us May 7th. We'll see you in DC.
Yeah, no, I love that. I love the fact about, we need to do this together. This shouldn't be done individually. And again, I think we have so much power in numbers and even just showing up in that way. And I'm going to circle back to one thing. We're talking about marching on Capitol Hill. And I've seen the comments, I've seen various different things in terms of nurses' perspectives in relation to being political. Gloria, what do you say to a nurse who says nursing isn't political?
Oh, but it is. It is.
How would you explain it? So I'm going to say to you, I don't believe that nursing is political. What would you tell me?
Yeah. So with your advocacy, when you're advocating for your patient, for your community, for your practice, you are already in that political space. So it's not necessarily political affiliation, but it is that awareness, the alignment, the collective intention. You're already doing it. And I think we have a really good a toolkit that you can purchase on our website of just how everything can be political, yes, but also how you can use the toolkit and use what you already have in your toolbox to make sure that you're advocating and to make sure that you're standing up for what your patients' needs are, your community needs, and to really make a difference. I think that gone are the days where nurses are just on the sidelines. We have to step up and own that political platform, that voice that we do have. We are the most trusted profession. We see that time and time again. But now it's time that we also become the most powerful profession, and powerful in the way that we organize, that we mobilize, and that we really stand up for our patients and what the public health actually needs as well. But I think that, nursing is political, and this is professional call to action now. Not so much reaction, but just action, and to assert what it is that we have. And that's for every nurse. Again, no matter where you're practicing, you may not know them, but you already have the tools to be political and to have that with authority when it matters. And it's right now.
Yeah. And Danielle, do you have anything to add to that, or?
I do. But first I want to pause on what Gloria said, that nursing is at the center of converging failures. And
Well, we're going to touch on it.
Listen, and then I just have to just let it just breathe for a second. And then the second part was the evolution of nursing leadership, how we're on the crux on that being incredibly important for the movement and advancement of our profession. I just wanted to say that just to get some air on the thing. But I'm going to be honest here. I was one of those nurses that felt like nursing was not political. And the reason why I felt that and believed that was because I did not understand the definition of political and what that meant and how that mapped directly to absolutely how nursing is political. And I mentioned it earlier that me being in my critical care, box world, I was just solely focused on patient sick. They've come in with ABC, XYZ. We're going to intubate, sedate. We're going to do all these things. I mastered that level of clinical practice and expertise and was like that was my focus and experience. And it wasn't until I got more exposure to systems level thinking when I went to DMP school. Shout out to my policy professor, Dr. Suzanne Miyamoto. She's the CEO of the American Association of Nursing. She was leading our policy course, and we had a Capitol Hill day, and she was dressed to the nines, had her stiletto heels on, walking up them Capitol steps and going toe to toe with those lawmakers, calling them out on things and amplifying the nursing profession. And they were listening. They were just like, and I was like, yo, okay, so I got to get some pumps and I got to get my suit, but that's when the light bulb came on about like nursing is political because they're making these decisions in this on Capitol Hill that dictates what I can do as a nurse practitioner, what I can prescribe, what healthcare my patients and families can get. And that's when I was like, absolutely. Now I understand the definition of political and
Right.
the through line of political lawmakers, decisions passed, implemented in my practice, guidelines, policies, and procedures on what I can do. And I was like, oh my gosh, like, yes, nursing is political because I was like, politics is dirty. You've got the red people and you got the blue people, and now that I've kind of debunked that stigma or fear or anxiety around political and politics, I'm like, oh no, we want you to have that understanding that nursing is political. There's just no other way we can slice it and dice it.
Yeah, no, I think that's so important that people pull it away from various different parties because I think that's where nurses actually trip themselves up, where it's just like, oh, Democrat, Republican. It's like, no, person. So if at the end of the day, we're treating the person, the individual, how do these policies, whether they're Democratic or whether they're Republican, how do those policies shape the development of care? Will this hinder the ability for my patient to heal? Will this hinder the ability for my patient to get better? That's how we need to think about it versus thinking about it red versus blue. Because I think that's where I've seen, for example, just recently, I'm trying to remember what the post was. Oh, it was actually a post by the National Nurses Association. But we're not going to get into the specifics of. But people are like, oh, I love Trump, and it's like that's fine. But start thinking about what policies there might be, whether it's Trump or whether it was Joe Biden or whoever it was at the time. How do those policies affect you? How do those policies affect the people that you say that you set out to take care of? And that's how we have to reframe thinking about healthcare. It's bipartisan. We are looking at the person first, not necessarily just, a political group. And I think if nurses can get away from one person or the other and look at the policy, that's where you can really start to see and understand how policies can shape care. And then the other piece that you mentioned where it's just like, oh, wait a minute. I'm here at the bedside or I'm here in this very critical position where I actually fundamentally understand what's happening. And these lawmakers have no clue because they're not there. So who best to help inform policies around patients than nurses? Like we are there all the time. We know what works. So why don't we have our stake and our say in these areas? We absolutely should. So that's the other reason why nursing is political and we should be involved in politics, and we should hold our leaders accountable. So I agree with both of what you said. I want to bring it back to a point where you discussed that, nursing is really at the center of being able to kind of shift change. And also we have to hold ourselves accountable when we don't. Nursing has a problem with racism. Just going to say that it is fundamentally an issue. There is no border. It doesn't matter whether you're in the US or Canada or in the UK. Nursing has a problem with racism. I don't know if you've read this article yet, but there was an article written by, I believe her name is Meg LaBrinch. It was entitled, "What Two Court Cases Reveal About Race and Power Within Nursing Today." And there's been many instances that we've seen in the last couple weeks surrounding nursing and racism. We can't get away from it. So, if social justice is one of the principles, is a core principle or core pillar, what does that look like practically in a political state where using the words diversity, equity, and inclusion are an issue and are very contentious within nursing?
So when we were conceptualizing around the energy for selecting social justice, it was to what Gloria has always been saying, to the point of actively working to dismantle systems that create health inequities so that everyone, regardless of race, income, zip code, identity, has equitable access to safe, high quality care and resources that they need to take care of themselves, how they define it. So that's how we were curating social justice, with the understanding of this climate that the focus is on the structures, because that's what's inherently creating these variances and inequities. And through understanding those structures, you see the through line of racism, discrimination, all the isms behind it. But for me and for us, if I can speak for us, is again linking it back to that policies that inform the system, that build the structures of inequities. So how can we focus social justice efforts on looking where those breakdowns are and directly targeting those root causes with solutions of a new system, a new structure, new policies, new leadership? So if I had to say that's the framing for today's time, that's the framing.
All right, Gloria, you want to add anything?
Yeah. If nurses are not shaping policy, we are always going to just be managing the fallout of that policy. Racism is fundamentally a social justice issue. We know that because it's embedded in the systems. It shapes where people live, what air people are breathing, what schools they attend. It dictates how they are treated within the systems that we all know and we're working in. In public health, racism shows up as patterned harm. So, for example, when asthma rates cluster in historically redlined neighborhoods, when maternal mortality is higher regardless of income or education, looking at like the climate aspect, when heat deaths track along a housing pattern, right? This is not coincidence. This is structural racism. We know that. Social justice asks, why do the same groups consistently carry the greatest burden and the greatest harm? Who benefits from these structures? And also, what policies, again, going back to the policy, what policies created these conditions to begin with? That's why racism lives most directly within, the social justice pillar, and why we're correcting that dangerous absence. I think that we're not addressing it, we're not talking about it, but we're marching. We are going to march. That's what we're going to do on May 7th. We are marching because that polite inclusion has failed. When we're looking at this question does make people uncomfortable, but we are marching because advisory roles without the authority have not produced the change that we are all seeking. We are marching because nurses have been invited to the table. We keep hearing that, right? We are invited to the table, but without being given real power to set the agenda. So marching is not just symbolic, it's a strategic visibility, like Dr. McCamey said. We are marching to disrupt that invisibility, I think, to force that acknowledgement and to signal that we are now a collective alignment, that we are shifting narratives, that we are demanding structural accountability for racism and for so many other things. But marching says we are no longer absorbing harm quietly. We're not going to remain silent. We are no longer negotiating for crumbs of influence. We are no longer asking permission to protect public health. This is not protest for, protest sakes. This is boundary setting for nurses. We have been, I'm going to go back to what Dr. McCamey said. We have been defibrillated. We have been awoken, and maybe we were a sleeping giant, but we are not asleep anymore.
Yeah, no, I think it's important that, again, even when the conversation is uncomfortable, that we have it. And I think that particularly in nursing, amongst our own community, it's a greater conversation. And I know I'm looking at the time, we don't have enough time to get into it, but I think it's important that we acknowledge and we center ourselves and understand that nursing has an inherent role within racism in the delivery of care, in the management, in understanding how even different nurses who are brought forward in terms of justice system. So, for example, I'm speaking specifically to, I believe it was Radonda Vought's case versus Don Quinnick-Joby's case. These things highlight systemic problems within nursing as a profession that we have to address. And I know we don't have time today, but another time we will address it. And I think it's important that we continue that conversation. I know we have 3 minutes left, and in that time, we're going to hit the goal where we need to talk a little bit about the leaky bucket. So current data, early 2026 shows that for every 100 new nurses, there's nearly 40 under the age of 35 are planning on leaving the profession. And we have a skill mix problem. I don't know. I'm sure it's probably the same across the border, where we're seeing shifts where there are new nurses all in the ED, everyone under 2 years, and that can't be the way that we run things. So in terms of the data showing that we're burning through our young nurses at an unsustainable rate, if we report to duty at rallies that you're organizing, what is one of the non-negotiable change that you're demanding from employers related to the exits and politicians? We'll start with Danielle.
I do want to just bring one point for the last segment that the Code
Absolutely.
of Ethics specifically talks about
Yes,
racism in nursing. It's provision 9. So that's one of my favorite provisions. So, and the provisions are free online. You just Google ANA Code of Ethics provisions. So to your question, the leaky bucket situation. Well, part of nurses shift change, in addition to HESS, we have our policies that are pillars that we stand on, and one of them is protecting healthcare workforce with sub-bullets around mental health, anti-retaliation, and workforce that reflects the communities served. And so, within that is also safety protections against violence for healthcare workers. So we absolutely are advocating in that regard for our safety as a profession, as one of our policy pillars.
Gloria?
Yeah, this is a hard one because I think we have already discussed, I think, to a certain point that we are burned out. But what has been probably the negative connotation that has not been really addressed is that burnout is an ethical injury. It's not just fatigue. And this is not the poster version, right, of looking at, oh, you're burned out, well, do this app, do this Calm app, or do whatever app. But what we are not saying clearly enough, in my opinion, is that we are not just tired. We are being ethically injured in whatever area you're working in or serving your community in, your patients. So ethical injury, we know that it happens when you know that the safe care, what it requires, and you know what your patient deserves, and you know what you can do to prevent that harm. But the system makes it impossible to deliver that. So over and over, shift after shift, going back to our name, right? Year after year, it's not burnout, it's moral harm that we are experiencing. And when nurses are forced between speed and safety, documentation and presence, policy compliance and patient dignity, that injury just it piles on, right? It just keeps on growing for the nurse experiencing it. So no amount of self-care fixes are going to be able to reverse the damage if the situation is going to be repeated over and over, shift after shift. So nurses' shift change reframes that burnout as evidence. It's not a nurse's failure. It's a system misalignment. So when we're looking at how resilience has become like a weapon almost, resilience used to mean adaptability in the face of crisis. But in nursing, resilience has been quietly, I think, weaponized. And we do not need more resilience. We need fewer ethically impossible conditions. And I'm going to go back to why we are marching in this time. And it's for, yes, all of the HESS principles, but we are setting that boundary again, that boundary that we are no longer going to accept this, and there can be change. So we have to refuse to normalize harm. That's what I hope that the viewers, the listeners can really understand and dive deeper into, our website, what we're standing up for you for. So I hope that you can see the line that we are driving, the line that we are drawing, and exploitation, ethics and endurance, adaptability and that accountability. So history already knows that we care, that nurses care. Again, we're voted the most trusted profession, right? But history has not yet decided is whether nurses will use our collective authority when the failure and the future of health is demanding it. So we are marching because care without power is no longer ethical. And we are marching because the public really does deserve systems designed by those who understand the consequences that are closer to the actual problem, right at the bedside. And again, in whatever area you're practicing, we are marching because silence is not neutrality and nursing is not supplemental to health. It is foundational. And we are hoping that moving together, we can create that brighter future that we know that we not only deserve, our patients deserve, the public deserves. So I'll end it there. But I think that we do definitely need a part 2 to talk about the other pillars.
I can't imagine someone not listening to this episode and not being inspired to be like, okay, this is something that we need to do. I do need to wake up and be a part of, something greater. I feel like I'm at like a Sunday sermon. Like I feel energized. And I think that it's important that, we show up in that way because all of the things that you both have touched on have really been inspiring and also not just inspiring, but truthful, right? I think it's just understanding fundamentally how all of these various different parts fit and how, as a nurse, whether you're on the bedside or you're in the community, how all of these conversations impact the way that we can do the work that we want to do. And then also say demanding better, right? So showing up and marching on May 7th. So I hope to be there as well. Maybe not there physically, but maybe there virtually. That you both are doing really, really amazing work. So thank you so much, Gloria. Thank you so much, Danielle. And before we go, anything that I've missed?
We are nurses. We are the shift. We are nurses. Shift change. We are nurses. We are the shift. We are nurses. Shift change. So that's our little chant. So y'all go ahead and practice for May 7th. Those are my parting words.
Thank you so much, Danielle. Thank you, Gloria, for coming on the Gritty Nurse podcast to share your knowledge, your wisdom with all of the listeners today. I'm inspired. We have much more to talk about. I had more questions, but I'm like, I'm running out of time. So yes, we'll have to have a part 2 for sure. So thank you so much for taking the time to spend with me today, and we will be in touch.
We'll see you May 7th. Bye-bye.
Looking for a great gift for a nurse or someone who needs to learn about nursing? Check out my national best-selling book, The Wisdom of Nurses, Stories of Grit from the Bedside. Thank you so much for listening to The Gritty Nurse with Amy Archibald-Varley. If you're watching on YouTube or listening on Apple Podcasts, Spotify, iHeartRadio, or any other podcast platform, please hit the subscribe button so you'll never miss out on any awesome episodes from The Gritty Nurse. Thank you so much and stay tuned until next time. Stay gritty.